Heart failure is not just a medical term. It's a growing crisis threatening global public health. More than 6.2 million adults in the United States live with this condition, and that number keeps increasing every year due to aging populations and sedentary lifestyles. Traditionally, it was seen as a problem for older adults, but today heart failure is appearing more often in younger people and disproportionately affects minority communities with less access to medical care. According to the 2024 report by the Heart Failure Society of America, the most concerning fact is that mortality rates in these groups are rising. The reality is alarming. The CDC reports that about half of all people diagnosed with heart failure die within 5 years. The risk grows even higher if factors like high blood pressure, diabetes, or high cholesterol aren't controlled. But there is hope. Early detection can make all the difference and improve survival by more than 50%. Your body rarely shouts its warnings. Instead, it whispers through subtle symptoms. Many people confuse these signs with stress, fatigue, or normal aging, when in reality, they may be early alarms of something far more serious that needs timely medical attention. This video is not meant to create fear. It's meant to empower you to protect your cardiovascular health. We're going to uncover 9 early warning signs of heart failure that can be easy to overlook, but crucial to recognize. They may not look like the dramatic chest pain you imagine, but they're just as important. By learning to recognize these signs now, you can take action before it's too late, reducing your risk of hospitalization or severe complications. Hi, I'm cardiologist Dr. Desa, your doctor who takes care of your heart. Welcome to today's video. Legal disclaimer. This video is for educational purposes only and should not be considered medical advice. Always consult a licensed healthcare professional with any questions or concerns about your health, medical conditions, or treatments. All information presented here has been carefully researched and verified. You can find the references in the video description, including sources from the American Heart Association and the CDC. Welcome to today's video about the 9 early warning signs of a stroke that can appear weeks before it happens. Every 40 seconds, someone in the United States suffers a stroke. But here's what most people don't know. Your brain has been desperately trying to warn you weeks before it strikes. Medical research shows that up to 43% of stroke patients experienced clear warning signs in the days or weeks before the event, signals that were often ignored or mistaken for minor issues. Before we dive into these life-saving signs, if you're new to our channel, welcome to your journey toward better health. We're here to empower you with knowledge that can literally save lives. Don't forget to like this video and subscribe so you don't miss our future health content. Your path to stroke prevention starts right here, and we're honored to walk it with you. And tell us in the comments, where are you watching from? We love hearing from our global community. Today we'll explore 9 critical early warning signs that can appear weeks before a stroke happens. These are not vague or random discomforts. They are scientifically documented warnings that your body sends when blood flow to your brain begins to fail. By the end of this video, you'll know exactly how to recognize when your body is crying for help and how to act before an emergency changes your life forever. 1. The sentinel headache. Imagine this. You wake up one morning with a headache unlike any other. It's not your usual tension headache or migraine. This pain is sharper, more persistent, and doesn't go away with your usual remedies. Researchers call this phenomenon the sentinel headache. A study published in the Journal of Headache and Pain involving 550 adults found something shocking. 14.7% of stroke patients experience this headache within the week leading up to their stroke. What makes this headache unique is its sudden appearance and intensity. It doesn't follow your normal pattern. It comes out of nowhere, can last for days, and often grows worse as the stroke approaches. The medical community recognizes it as a brain distress signal, a warning that blood flow is already being disrupted. If you experience a severe, unusual, and persistent headache, don't ignore it or blame stress. Your brain could be trying to save your life. 2. Transient ischemic attack, the mini stroke. Here's where things get serious. Imagine that suddenly part of your face droops, your arm feels weak, or your speech becomes slurred, and then everything returns to normal after a few minutes. You might think, it's over, I'm fine now. But the medical truth is terrifying. These episodes, known as transient ischemic attacks, are dress rehearsals for a full-blown stroke. Research from the American Heart Association shows that 43% of people who later suffered a stroke had a TIA within the week before it. During a TIA, blood flow to a part of the brain is temporarily blocked, causing stroke-like symptoms that fade once the blockage clears. But they are not harmless. They are powerful predictors of a coming stroke. If you ever experience sudden weakness, numbness, vision problems, or trouble speaking, even if it passes quickly, treat it as a medical emergency. Your brain just showed you a preview of what might come next. 3. Dizziness or balance problems. Have you ever felt as if the world was spinning or suddenly lost your balance for no reason? While occasional dizziness can be harmless, persistent dizziness or coordination problems may be early signs of a stroke. Studies from the National Heart, Lung, and Blood Institute identify these symptoms as early indicators of disrupted blood flow. They occur when the areas that control balance and spatial orientation begin receiving less oxygen. The danger lies in how subtle they are. Many people blame the inner ear, medication, or age. But if dizziness comes with headaches, blurred vision, or weakness, it could mean your brain is pleading for help. 4. Vision problems. Your eyes aren't just the windows to your soul, they're also a window into your brain's health. Sudden changes in vision, blurred sight, double vision, or partial loss of sight can be early warning signs of an upcoming stroke. This happens because the brain's visual sensors are extremely sensitive to changes in blood flow. Medical studies have shown that these problems often appear days or weeks before a stroke. You might notice difficulty reading, trouble judging distances, or even brief blind spots. If your vision suddenly changes or becomes intermittent, don't ignore it. Your brain may be sounding an alarm. 5. Trouble speaking. When your speech suddenly becomes slow, confused, or slurred, your brain is waving a red flag. Speaking clearly requires the perfect coordination of multiple brain regions, so speech problems are a powerful early sign. You may notice your words dragging, your pace slowing, or difficulty finding the right words. Sometimes people can hear others clearly, but can't process the meaning because their language centers, Broca and Wernicke areas, are starting to fail due to poor blood flow. If your speech changes even temporarily, seek immediate medical attention. Your brain might be warning you of dangerous vascular trouble ahead. 6. Weakness or numbness on one side. If your arm, leg, or face feels weak or numb on just one side, don't dismiss it. This symptom, known as hemiparesis, often shows up weeks before a stroke. At first, it may seem subtle. Maybe you drop things more often or feel heaviness in one leg. But one-sided weakness means part of your brain isn't getting enough blood. If these symptoms repeat or worsen, seek help urgently. 7. Unexplained fatigue. We live in a world that glorifies exhaustion, but deep, unexplained fatigue can be an early warning sign of a stroke. This fatigue doesn't improve with rest or isn't tied to physical exertion. The reason is that your brain consumes about 20% of your body's energy, and when blood flow drops, it begins to conserve energy. That leads to a deep mental and physical exhaustion that feels abnormal. If you feel drained for no reason and also notice mental fog, poor focus, or low motivation, don't ignore it, especially if it combines with other symptoms on this list. 8. Unusual hearing loss. It may sound surprising, but sudden hearing loss can be an early sign of a stroke, especially when paired with vertigo or dizziness. This is called sudden sensorineural neural hearing loss, or SSHL, and is linked to circulation problems in the brain's posterior region, the same area that supplies the inner ear. Studies show this hearing loss appears quickly, often in just one ear, and can occur hours or days before a stroke. If it's accompanied by dizziness or balance problems, and you have risk factors like hypertension or diabetes, Get medical attention immediately. 9. Unusual neurological symptoms. Finally, there are rare but serious neurological signs that may appear weeks before a stroke. Sudden confusion, trouble understanding others, seizures, unexplained nausea or vomiting, or even temporary fainting. These are often misinterpreted as stress or fatigue, but when they occur together or repeatedly, they can signal dangerous disruptions in blood flow. If you experience multiple of these symptoms, especially if they feel different from your normal, seek medical care right away. The 9 early warning signs we've discussed today reveal your body's incredible ability to warn you before disaster. From sentinel headaches to speech changes, unexplained fatigue, or sudden hearing loss, each one is an opportunity to prevent tragedy. Remember, stroke is preventable if detected